Hi, everybody. We're coming to you live from Phoenix, Arizona. Please pardon my hair, lack of makeup. I'm on a vacay, but I wouldn't miss this opportunity to hang out with you guys for a million bucks. So I'm taking a break from a vacay to come hang out with you and Dr. Scott Munsterman. Now, fingers crossed, because I have sketchy Wi-Fi, that hopefully you can hear him because I cannot. So, Dr. Scott, say hi.
Hello.
Y'all could
Let,
just throw
let
that
us
line.
know if you can hear me.
No, you can't. Let me know what's going on. Um, Many of you probably recognize Dr. Scott. He is basically like a healthcare expert. He is one of those incredible people who likes to read all of those 3,000 page updates that they like to come out with. And he like breaks it down to let us know what it is that we need to know within the profession. He is the CEO of Best Practices Academy. He is a graduate of Northwestern Health Sciences University. He has served 2 terms as mayor of the city of Brookings and 3 consecutive terms in the South Dakota House of Representatives. So I think that what's really cool about this is he understands policy. He understands and loves chiropractic, and he sure as heck understands how all those policy changes are made. And I think that is such an invaluable resource that we have within this profession with Dr. Scott. I could say lots of other amazing things about him because he's pretty super cool. And I love every opportunity to hang out with him, which is why he's a frequent guest. But y'all really didn't come here to hear me gush about him. What y'all came here is to hear about OSHA updates, and he's here to deliver those. So, Dr. Scott, take it away. And since I can't hear you, just wave at me when you're ready for me to come back.
All right, sounds good. Sounds good. Well, yeah, thanks for joining us, everybody. It's been probably several months since we've had a chance to kind of touch base and see where we're at on things. And what we thought would be a good idea would be to bring everybody up to speed on what OSHA has been up to here over the last few months. And we'll give that update. And as, of course, in regards to COVID-19. And so what OSHA has been working on right now is that they implemented what's called an emergency standard, and that temporary standard ETS is in regards to COVID-19, and they will be putting together a final version of that. But as of today, they don't have that. Rumor has it that that will be coming out soon, and so you can be looking for possibly another webinar update within a month or 2 or 3, whenever that occurs. What my experience has been, though, as a legislator and just being in the business of compliance for so long, is that typically when they come out with emergency standards or interim type rulings, very seldom is there a whole lot of difference from the final version. Very seldom. But having said that, now we know that there could be. And so what we want to do is we want to get you up to speed on where exactly they're at. This won't take very long to bring you up to speed, but these are the references that we've been able to really go to and that you can go to read more about where did we get our information and what does it mean to you? And that's really the key thing here. How does this affect you? Well, let's go ahead and take a look at what that emergency temporary standard looks like. Now, this particular document is straight out of OSHA. And what it is it helps clarify who is under the emergency temporary standard, and which will eventually become that final rule when it comes to COVID. Well, if we start with the flow chart in the first bubble, we'll see that it states, is the workplace a setting where any employee provides healthcare services or healthcare support services? Well, in our practices, the answer is yes. So we move to the next bubble. And the next bubble states, does the workplace meet all of the following conditions? All of these conditions. Is it a non-hospital ambulatory care setting? Are all non-employees screened prior to entry? And people with suspected or confirmed COVID-19 are not permitted to enter. Okay, and so what this says is that if we are screening everybody that are non-employees from entering into our clinic facility we're a non-hospital ambulatory, which we are as chiropractic practices, and anybody that we could suspect has COVID-19 or has been confirmed, that we don't allow them to enter, then guess what? Then this standard does not apply to our practice. All right, so let me repeat that. This is very important. As long as we are screening non-workers, non-employees, and we're going to get to the employees in just a bit, but as long as we're screening people before they enter our clinic, and we are not letting people with suspected or confirmed COVID enter the clinic, then we are exempt from the OSHA standard as it is written today. All right. And so again, the disclaimer is that this is the emergency temporary standard. We do have a final ruling that'll come out hopefully shortly. But this is where it stands today. And so where does that bring us? Well, does that mean that we're off the hook? Well, of course not. But it certainly keeps us from having to comply specifically to specific standards within that requirement, the COVID-19 OSHA standard. But what are we under yet today? Well, what we're under is what's called the general duty clause. And that requires all employers to provide their workers with a safe and healthy workplace that is free from recognized hazards, or that those hazards have been looked at and they were mitigated by training or work practices or other types of control measures. And so OSHA is still very concerned about, okay, even though we as healthcare providers, because we're in the setting we are, and because we do screen people from, suspected or COVID tested people that have COVID, we're screening them out of the clinic, that we still fall within the guidelines of the general duty clause, which says we still have to provide a safe work environment. And so OSHA then has laid out, along with the CDC, guidelines that help employers that are not under the OSHA standard to know what do they need to do to make their workplace safe. Okay. And so the guidelines that you're going to see are going to speak to that. We broke them down in just a few key areas so that we can kind of hit it hard in those areas. And it also takes into consideration is your staff or doctors, have they been fully vaccinated, not fully vaccinated, are they at risk? And so all of the recommendations that we're going to talk about now from this point moving forward, they are recommendations by OSHA. They're recommendations by the CDC. They are considered advisory in nature. And you'll hear language like strongly recommends. And so you can look at this from the perspective that within legislation overall, you have things that are required. And typically that's using the word shall. You shall do this and you shall do that. Or you have recommendations, and that is may. You may do this and you may do that, or that we strongly recommend you do this because we know that it'll be better and it's a best practice, or that type of a thing. Now, as you scratch your head and you think about, if they're just recommending it and they're just advising it, they can't get me on anything, so I'm just gonna, do whatever I want to do. Well, I would exercise caution with that turning a blind eye to what is strongly recommended could come back to anybody within a governing body, agency, public health, that type of format that are coming to do like an investigation in your facility or that type of thing. You better have a pretty darn good reason why you didn't follow a strongly recommended piece of advice from a governing agency. And that's all I'll say about that. And so again, keep in mind, this is what OSHA has recommended. This is what the CDC has recommended. And right off the bat, as we hear a lot of information from the leadership in the country and other public agencies. While in addition to that, OSHA is the same, that they emphasize that vaccination is the most effective way to protect people against severe illness or death. And they strongly recommend, here we go with the strongly recommend language, and encouraging employers to provide paid time off for workers that take time off to go get vaccinated and or recover from any of the side effects from the vaccination. Now, has OSHA required and mandated vaccinations? No, not at this point. Okay, but again, that could change over time, and so we want to make sure that we keep our ear to the ground and know exactly where they're at when it comes to other types of requirements. Now, what they do say within the general duty clause, and there are a number of OSHA standards that speak to exposure control. So in the area of, such as bloodborne pathogens, yes, there is a standard and we need to comply to the bloodborne pathogen policy, which is very similar when we talk about exposure control mechanisms for other types of infectious diseases. And so keeping in mind that this is something that we currently should be doing, many of these things, as we get into some of the tasks that we want to make sure that we cover to mitigate any risk. Certainly those are some things that we should already be doing and that we certainly are under in terms of an OSHA requirement. Now, what is the CDC and OSHA concerned about? Well, what they're primarily concerned about within the place of business, the healthcare facility place of business, would be those people that are unvaccinated and those people, staff, doctors, that are considered at-risk workers. Okay, and what they're considering unvaccinated would be anybody who is not fully vaccinated. So if out of a series of 2 shots, if an individual, staff or doctor had 1 shot, they would be considered unvaccinated, or if they didn't have any, obviously. But then also the consideration that they make is for those people, those staff and doctors that would be considered at risk. And so this link brings you right to the list of comorbidities, and so if the individual has a history of cancer or chronic kidney disease or liver disease, and certainly any other types of issues like dementia or cystic fibrosis or diabetes, obesity and the like. And so keeping in mind that individuals that have specific comorbidities that now have been shown to be complicating factors in moving people more towards severe critical illness if they do contract COVID, that these are regarded as people at risk. Now, the other thing to bring into the equation and also think about is the fact that the American with Disabilities Act does cover people who are at risk who may not be able to get vaccinated. And so there could be some people that there are medical reasons why they can't be vaccinated. And if they are in your place of work, then it's imperative for you to do what you can to make reasonable accommodations to help them avoid the risk of contracting COVID. And so as we get down this road, your responsibility as an employer all of a sudden begins to broaden out even beyond what OSHA requires and CDC requires. And now we also have the American with Disabilities Act that we have to bring into consideration into the whole dynamic of this picture. And so just kind of right out of the gate, just kind of setting the context and in terms of how that rolls out. So let's talk about risk. And we've talked about risk before, and OSHA lays it out very easy. It's very high, medium, and low risk. And the different exposure levels have to do primarily with how is that individual placed in a position of risk. What are the things that they're doing? What are the job tasks that they're doing? Are they performing, collecting or handling specimens or any other types of infectious material? Or are they going to have readily exposed to body fluids or aerosol or droplets, that type of thing? Is that their job? Is that going to expose them? Then we have the higher risk of exposure that is just a lower level, and this could be, are they working with bodies, in terms of transporting and people that have known or suspected COVID? Okay, What is their risk? Well, as we go down the risk factor, we do end up seeing our practices in the lower exposure risk. Why is that? Well, the fact being is that if you are screening people that have suspected or known COVID out of your clinic, right away, you've lowered that risk. Now, the caveat to that is that the statistics show that over 50% of the people that have COVID, guess what, are asymptomatic. And so there's only so much you can do in your screening methodology. And then considering other factors, which we'll get to in just a brief minute. But the bottom line is that understanding what is your current level of exposure today, and that could be different 5 days from now. Okay, so let's talk about exposure risk. And what we want to teach you during this time here is to understand that this is a thinking process for you. This is something that you want to be able to discern. What do I do today? Or is there something I need to be doing different, tomorrow? Well, let's talk about that, because exposure risk is going to be based essentially on these three things as what we know today. All right. And we already talked about the COVID screening, which we'll talk about some questions that will help refine that screening method. Then we're going to talk about your community spread. And so there's more and more data about that. It's updated in real time. And then finally, we'll speak to implementing those multiple layers of controls, as OSHA calls it. And so when we look at the COVID screening, what we did is we pulled in these three primary questions, and this comes direct out of the OSHA standard. So if we had to comply directly with OSHA, these are the questions OSHA says you have to ask. All right. And so we brought them in here, and it really helps refine now our screening methodology, because if you remember over a year ago, we had, several questions, and we were taking body temps and all of that, because there was so much we didn't understand about this disease process. So here we go. Are you COVID-19 positive or been told by a licensed healthcare provider that they are suspecting that you have COVID-19? So that's one question. Another question, second question, that is, are you experiencing recent loss of taste or smell with no other explanation? All right. And then the third question is, are you experiencing both fever and new unexplained cough associated with shortness of breath? Notice how they brought that together. Now, as we think about these three questions, certainly this is our screening methodology for people coming into our clinic, not only patients or visitors, but then also when we start talking about workers, it's the same screening methodology. Now, one of the things that kind of was in the back of my mind was, gee, do we still need to do body temps as a screening mechanism on everybody? And so the more reading that I did, and especially over the last several weeks, and reading through OSHA and CDC, nowhere did I find that you're mandated to take a body temp on a screening. I could not find that. However, what I found was reference to that if somebody is experiencing a fever, or if you are palpating and they're feverish, then you certainly want to check their body temp. So it's kind of the mom check a little bit. Mom puts her hand on your forehead. Oh, Scott, I think you're running a fever. We're going to check you. That's where the body temp comes in. All right. So three questions, refined better. These can be very valuable now moving forward to be able to pinpoint exactly what we need to do for screening. And so, as we mentioned, non-worker screening, and that's, gets us out of complying to the direct standard, right, with OSHA. But then now we're under the recommendations and advisory of what do we need to do to keep a safe work environment. So that non-worker screening, very critical. And then we have our worker screening, and that would be our staff and our employees. Now, there's two ways you can go about this, all right? And so you can go about it now with just your workers doing self-monitoring, self-screening, meaning that they're instructed that if they have any of these symptoms, that they need to not come to work and that they need to see their medical provider, okay? or you can take the responsibility of doing on-site screening of your workers. Now, in the event that you do the on-site screening with your workers, then you need to realize that that becomes a medical record on that employee, and that those medical records need to be kept as a separate employee file, separate from the personnel record. That is OSHA standards. What we're recommending to our clients is that make sure that you instruct, train your employees. Here's what you're looking for, and call me if you have symptoms, and certainly go see your healthcare provider, get tested and be able to follow it from that point moving forward. Unless you want to do that in-house, do it yourself, and then just be aware that that is a medical record, and that needs to be kept for that screening. So first off the bat, how do we reduce our exposure to risk? We're screening. All right, very clearly we're screening. Second thing we're doing is we track, and you should track, where your community's at. What is the risk in your community right now? So this is a great website you can go right to. And what I did was I loaded, I think this is recent from a few days ago, Brookings County in South Dakota. That's where I live. And so you can see we're in the red zone. And if you look at the state of South Dakota there, you'll see where I've circled in red our county, and our county is bright red. Well, we have a Division I university here, about 13,000 students. We have a very robust economy. We probably have 40, 50,000 people here in our community each and every day. And so we're a bit of a mecca for our area, being even the small community that we are compared to others. So, but this tells me where we're at in our community. Now, as you check this, and I'd recommend you checking it at least on a weekly basis to be able to know that, okay, if you're in a higher, if things have risen in the risk community spread department, that may make a decision for you on what you want to do for control measures in your clinic, potentially. And so again, we're teaching you how to think about what's going on around you, and then deciding, what do I need to do here? Do I need to step up my game more? I mean, is there a greater risk? We need to, do more of whatever to mitigate that and control that coming into the clinic facility and all that. So keeping in mind that, secondly, tracking your community spread is very important. And then finally, what OSHA talks about are using multiple layers of controls. And so we're all very familiar with this, and we should be over the last year and a half now, are these multiple layers of controls. And so we talked about removing people out of the workplace that could be potentially infected. We've got mask wearing, using personal protective equipment to help source control yourself, and protecting. We have our distancing that we all understand, and being mindful of that. Increased ventilation within our facilities to make sure we have good airflow, proper cleaning, getting dirt, debris out of the way, and then disinfecting after that. The methodology for that. Are you doing it routinely through the day? And they're recommending at least twice a day, depending on the traffic that comes through your clinic. Okay. And also the terminal cleaning that is done towards the end or at the end of the day. Proper hand hygiene. We're very familiar with that. And then obviously training, and training being very critical all along the way. And so between these three areas, the screening of your workers, your staff, the doctors, people entering the facility, keeping COVID out. Okay. Second control measure is understanding what's going on around you. And then, of course, the third is utilizing these multiple layers of controls within your clinic facility to continue to reduce the risk of the spread of COVID that could be potentially existing within your clinic. And of course, all of those things have been the strongly recommended advice and that CDC and OSHA have laid out. And so that's kind of where we're at with all that. And like I mentioned before, we certainly are going to hear more when we get that final ruling from OSHA, and we'll see how far it deviates.
So
And Christy, we
keep
got you
talking.
back on. I don't know if you can hear me
Okay, I
yet.
just made you bigger. I still can't hear you. I'm so sorry.
Okay. So,
But I do have questions.
okay, perfect.
I could read that. You said, okay, perfect. I have a sign on the door with screening questions. Is this considered screening?
It's considered part of the screening. And so when the patient makes an appointment, I would still recommend that you cover your screening verbally with the patient as just part of your policy. But signs in the clinic, signs on the door, those are good notifications for people.
Okay. Our next question, if somebody has had COVID, must I mandate the vaccine?
I'm sorry, read that one. Let's see here. I know Christy can't hear me. I'm trying to find the question that you just
It's kind of
read.
halfway down the chat log.
Oh, there it is. If someone has already had COVID, must I mandate the vaccine? No, you don't have to mandate. As what OSHA does state as an employer, that you can mandate vaccinations if you want. Okay, but it's not saying that you have to. All right, and at least at this point, they're not. And so what you can do though is that, again, exercising the control measures, identify if you have any workers that are at risk, like we mentioned earlier on, because if you do, then you want to be mindful about where that person's at, do they have higher risk of exposures or not, in the clinic and in where they're at, and just being mindful of that so that you can help protect them. That's going to be important. But you don't have to mandate vaccinations as an employer at this juncture.
Should we be taking patient temperatures on each visit for COVID screening purposes?
So, like I mentioned earlier, or towards the end here, I have not found any mandate that you have to do the body temp. However, you're asking the question about fever, and if somebody does have a fever, then you would want to follow up with a temp or just refer them out. And keep in mind that when you physically do the temperature, you are allowing yourself at an increased exposure if that person does have COVID. And so I think part of their thinking process is that if they answer yes to any of those questions, that they should just not enter the building, period, and that they need to see a healthcare provider. And so that pretty much negates your need to take body temp, if they've answered any of those three questions affirmatively.
Okay. Do we ask screening questions verbally to the patients each visit or just to new patients?
I recommend when they make that appointment, you ask verbally. And it doesn't matter if they're new patient or previous patient. And like we mentioned earlier.
Okay, that seems to be, nope, go ahead.
Oh, I'm sorry. As we mentioned earlier, signs on the door, again, notifications within the practice.
Okay, I think that's all the questions that we have. Thank y'all, Maria. I know y'all can hear him. He can hear me. I can't hear him because I'm in the middle of the mountains in Arizona. And apparently my Wi-Fi is a little sketchy. And just like when y'all are connected to Wi-Fi, it can affect your audiovisual quality. It is affecting mine. So I can see everything. I just can't hear anything. But I want to thank everyone for joining us today. And thank you, Dr. Scott, for tuning in for what may be the strangest communication on a webinar ever before. But I want to thank everybody for joining us today. The link to the webinar recording will be sent out to everyone in about an hour. So just be on the lookout for it. It'll also be available on the website under archived webinars. Dr. Scott said that when the final ruling from OSHA does get released, we are going to do another update webinar. If you have any additional questions, you guys know you can email me, Christy at ChiroHealthUSA.com. And here, I can turn my, hi. Hopefully y'all can see that. I sure will, girl. So if you have any questions, just email me, Christy at ChiroHealthUSA.com. You can also email info at ChiroArmor.com. Just know that right now, since I'm at an event, you're going to get my out of office email, but I am checking my email periodically. So if you have questions, I'll be happy to forward those to Dr. Scott and we'll get answers for you. If you're watching the recording and have questions, please, by all means, submit those questions over again to Christy at ChiroHealthUSA or info at ChiroArmor. We'll get those questions answered for you. I'm super excited that we're going to be wrapping this up 30 minutes early because that gives you guys time for a legitimate break to eat your lunch, to rest, enjoy the day. I do want to let y'all know about what's coming up. We've got a lot of great webinars coming up this month and next month. Next month, we're featuring Caring for Veterans, Considerations for the Private Practitioner with Dr. Nathan Hinkleday. Yeah, Hinkleday. I say this wrong every time. Let me show you on my screen. There it is. Then we're going to be optimizing practice management, DME implementation, building and leading your A team, and then who cares what you charge with Heather. So that's super exciting coming up. But you can check those out on the website at ChiroHealthUSA.com. Anyway, I want to thank you all again. Enjoy the rest of your afternoon. Submit those questions over. And Stephanie, I most definitely will because I'm on my way to go see Lisa right now. Y'all have a great day and we'll see you next week. Bye, y'all.